Okay, can you all see my screen?
Yes, ma'am.
Okay. So this is our second module, assessment process in health and social care setting. So in today's session, at the end, you will be able to define the term assessment and the factors which are associated when we are talking about the assessment, and identifying the strength in assessment. So what are the strengths that this assessment is having? And describe the assessment process or the assessment cycle, and what are the available different methods or the types of assessment, and briefly explain the assessment, the critical role. When we are talking about the assessment, what are the critical role in the assessment, and to identify the qualities of a good assessment and the principles of assessment. And also we are going to see the comparison between the assessment and the evaluation, and you need to define the term assessor and the skills and abilities of a good assessor. These are the contents of today's session. So we'll see one by one. So an introduction or the overview for the assessment. So when we talk about the term assessment, so simply this assessment means, so it is a process that which we are used to gather some information related to an object or related to an individual or related to a non-living object or whatever, or the disease condition, or related to a person's working abilities or whatever the thing. So assessment means it is just we are in a simple term, or you can have mug up, or you can have in mind. Assessment means just collecting or gathering a data or the information related to a particular event or related to a particular thing. But so this gathering a data is some kind different when we are talking about the assessment. So the information that we are gathering during the assessment, it should be accurate and it should be oriented to the particular field, and the information that we are gathering should be evidence based. That means we should have some kind of evidence. We need to justify it. So all these things we are calling it as an assessment. And also when we are talking about the assessment, it is a kind of process. So you all know what the term process means. Process means it is having some sequential steps. So first we are doing this, then there could be a second step or third step. Likewise, there could be some sequential order. So this assessment is going in a process form. So when we talk about the health and social care setting, the assessment is the important one. So rather than social and the healthcare setting, when we talk about other workplaces or other any activities, we are having this assessment. That means normally when we are doing, before doing anything, we are gathering the information. We are searching and we are getting the information about a person or whatever. So it is also a kind of assessment. But sometimes those information gathering won't follow any sequential order. It is just one-time information gathering. Or sometimes the gathered information could be suspicious. We are not having any evidence to prove those informations are accurate. So if those properties are available, then we can't say it as an assessment. Okay, it is a different kind. It is just gathering a information. But when we talk about health and social care settings, this assessment is the most important one. Why? Because in the health and social care, we are going to work with the patients, the people or the public or the patient. So when we are providing care and support to them, we need to know a full information regarding a particular individual. Then only we can provide a better care which could improve the quality of life of a particular individual. So for that, we should have some kind of sequential steps. So with the sequential steps, we are gathering much information. So how much we can gather, how much extent we can gather, we are gathering so much of informations through that sequential steps. So that is, we are calling it as an assessment. So assessment is the first step in the problem solving process in social works. Yes. So when we talking about the problem, so issues that are arise in a health and social works or the healthcare settings, so those problems we can't resolve at once because those problems are some kind of critical problem. We need critical thinking and we need to solve them critically. So for that, this assessment is important. So through this assessment, we are getting more information, and with the information, we are going to work how we can solve this particular problem. The process in which data is collected from the concerned person or group in a systematic way using prescribed and skills and is then assembled together for the purpose of analysis even at later period. Yes. So another important part of this assessment is we are not gathering the information to use only for a particular instant or the circumstances, not only for the shorter period of time. But the data that we are collected for by using this assessment could be used even after the problem solved. That means if any problems occurs in a future, if the same problems occurs in future, for the solution, we can use this information as a pioneering information. So that's why we are telling that the data collected with the help of in the assessment, it should be very, very accurate. And also another, it is a kind of systematic way. That means systematic way means you can't collect the information, so you can't collect anything in your own way. So for each and every collection method, we are having some kind of steps. For example, when we are talking about the patients in a hospital setup, so both the physicians, that means doctors, as well as the nurses, we are having a separate guideline to collect the data from the patients. Once the patient admitted to the hospital, before proceeding the treatment to the patient, both the doctors as well as the nurses, we are having a kind of guideline to get more information from the patient. So in that, so we will learn all these things step by step in our future classes. So as an overview, I am telling now. So when we talk about the nursing officer, so as a nursing officer, first we are telling it as a history collection. History collection means we are gathering the informations by asking verbally from the patient. So in that history collection, so commonly the term is patient health assessment. In the patient health assessment, we are having two major parts. One is history collection and other one is a physical examination. Physical examination means we are examining the patient physical body. It could be done by the doctor, and as at the same time, as a nursing officer, we are also going to do the physical examination. So physical examination means, wait a minute. So physical examination means, so we are going to check all the external as well as some internal organs, so the internal activities of the human body. And simply we are telling it as a head to toe physical examination. So most of you are not if you are not related to the nursing field or the healthcare field, you are not familiar with these terms and those things, but you need to know. So in this module, as when you are going to work in a social or the healthcare sector, you need to know all those things because this assessment is not only confined to the doctors or the nurses, but as a overseas workers, you also need to maintain because assessment is simply we are gathering information. Okay. So in the physical examination, we are we are telling it as a head to toe assessment. That means from starting from the head up to the toe of one individual, we are checking each and every parts of the patient body. That means when we take about talking the head, So in the head, we are checking how the patient, whether the patient is having any fractures or whether the patient having any stitching, that for if the patient accident and there could be some marks could be there after the removal of the stitches. So if the stitches are present, or and also we are checking what is the color of the patient here, because not all the people are having all same color. Sometimes they maybe have white color or black color, brown color, or sometimes they may have artificial colors, because for some people the artificial coloring are not good for their scalp. So itself can cause us some kind of disease condition to the patient. So that's why we are checking whether the color is a natural color or the artificial color, and whether the patient is having dandruff or whether the patient is having lice, and how the patient hair, whether it is curl one. So those things, because each and every condition we need to check, because if the patient is having lot and lot of dandruff, then the presence of dandruff can cause us other skin problems to the patient. The patient may have so many pimples and all those things in the face, and those are very itchy, and so those kind of things we can identify. So that is one example for the head. And then we are checking the face. So in the face, we are checking how the eyes of the patient, whether the patient is having any swelling or in the eyes, around the eyes, or any other discharge. Discharge means any other oozings are coming out from the patient eyes, or normally when we are seeing that our that white color part. So normally we are having in the middle, we are having a black color, a small round shaped part, and around that we are having a white color part. But sometimes some people may have yellow color. So that yellow color indicating the jaundice. So there is one disease condition called jaundice. So if the jaundice is present, then that white color part becomes yellow color, or sometimes it becomes red color, dark red color. And also that circular part, it is normally as you can find in other your friends or with the family members, not all the people are having a black color round part. It could be sometimes ash color, and for the foreign peoples, for the white peoples, they are mostly having it in a ash or the light blue color. And Asian peoples, we are having black or brown in color. That means sometimes for a beauty purpose, girls, they are using a lens. So that lens itself having different colors for the changing, for the beauty purpose. So those things we need to check whether the color of that part is, it is a natural color or the artificial color. Likewise, we are checking each and every parts in our external body. Then we can identify. So why we are doing each and every part, then only we can get maximum information of a particular patient. So it is, we are called, it is one criteria coming under the patient health assessment, which is a physical examination. Then I told you that we are having another part called history collection. So under the history collection, so we are asking from the patient, we are letting the patient to talk and express as much as possible by him or her. So it is also contains some criteria, like we are having a personal information of the patient. So under the personal information, we are asking name of the patient, age, and we are writing the gender of the patient, then how the occupation is, what is the marital status, whether he married or unmarried. So though, and normally in the hospital setups means we are writing that when he admitted and what is the time of his admission to the particular ward. All those things we are writing. And other next to that, we are writing some complaints. Complaints means problems. So under the problems also we are writing why this patient admitted. So when the patient admitted, what are the problems he stated to the doctor. Sometimes he may told that I had fever, I had vomiting, or I had red spots in my hands, I can't eat or I can't swallow. Then we are asking, so after 2 days of the patient hospitalization, then again we are collecting some assessment. So in that we are asking how you are feeling now. whether you are still having vomiting or still you are having fever, or did you develop any pain after admitting to the hospital. So those we are telling it as a presenting complaint. So after hospital admission, how the patient is having those problems, whether the patient developed any problem, or with our treatment, whether the patient previous problems resolved or minimized. So those things. In addition to this, we are asking some information related to if the patient is having any previous medical conditions like diabetes mellitus or any hypertension in our diabetes mellitus means increased blood sugar level, or if the patient having any previous cancer, or if the patient undergo any previous surgery. Why we are asking these previous things? Because sometimes the management that we are giving to the treatment that we are giving to the patient now can counteract with the previous disease condition, because yeah, there are some medications if when we are giving to the diabetes, it can counteract to the medications. That means it can interact means they can react, both the medication can react with each other. So if there is a reaction present, then it will cause the problematic effect to the patient health condition. So that's why we are asking. So with that we can identify, okay, so the patient is having diabetes. So he was on this medication during these 10 years or 5 years for the diabetes. So when we are managing for the patient disease condition now, we need to check. So those things. And another important thing is allergy. So when we are talking about allergy, we are normally asking regarding whether the patient is having any allergies for the food, plasters, and sometimes drugs. So normally, most of us are not aware about if we are having any allergic to the medications, tablets. Sometimes even Panadol can cause the allergic reaction to some people. But we are not most of the time we are not aware. But this plaster we can ask, because no, most of the people are having some allergic or itching when they apply the plaster. So we need to identify alternatives. So but they always know what are the foods that we are allergic to. Right? We may not aware about the most food comes in most of the other food. It is so simple because normally in the hospital setup, they are providing foods to the patients. In the hospitals, if the neighbors are not available, we can get the diet or the food from the hospital. So we need to know, because family members, they know, okay, these foods are allergic to the patient. But in the hospital setup, if we are not gathered that information, then going to give those allergic food to the patient, and that can cause adverse to the patient. So that's we are asking those information. Likewise, so we have these two different kinds of gathering information guidelines, which we are calling as a patient health assessment. So it is a kind of process. That means
Miss, we can't hear you.
Assessment. Goal setting and interventions largely depends on what is
Miss,
being assessed or has. So here are the interventions. Goal setting means we are planning. So what we
excuse me,
can
ma'am.
do. Yes, you can tell me.
Yes, we couldn't hear past part. I think some
Last
internet.
part means the third point.
Yes, third point and I think second point. Can you repeat,
Se
Miss?
Second point also you couldn't hear. Okay, I'll
Okay,
repeat it.
okay. Thank you.
So simply assessment. So in the second point, it was mentioned that it is a process in which data is collected from the concerned person or a group in a systematic way using prescribed and skills and is then assembled together for the purpose of analysis even at later period. So I told you that already. So assessment is a kind of information gathering, but in the assessment we are doing it in a systematic way. Systematic way means it is in a sequential way or in an organized way. So this assessment, during the assessment, the informations that we are gathering, not only helpful for the on-time management for the particular individual or the patient. So those informations we can keep and we can use even in a later period as well, because sometimes the patient may also develop this kind of problems or issues in future. So if we gathered most of the informations, then it could be useful for you to be used in a future management as well. So when we talk about the assessment, normally this assessment is important in a health and social care. Why? Health and social care means you all know that we are dealing with the people's life. They are survival. So our major motive is to improve the quality of life of a patient. So in order to maintain a proper quality and in order to provide a good care services to the patient, we need to get maximum information. Then only we can plan our management according to the patient condition. But when we talk about other workplaces, there are also we are having assessment, but it should not, we are not considering or we are not giving most prominent importance to them. But in the process, in the health and social care, the assessment is the major part. So when we talk about the healthcare, so this assessment, it could be a physicians, that means doctors or the nurses. We are having a separate guidelines in order to collect the informations from the people or the patients who are admitted to the hospital or any other care receiving centers. So we can't, as a healthcare professionals, we can't arbitrarily take the informations whatever we thought. So if I think And also I can't assume that, okay, these informations are enough. So it is not the way of collecting the informations in a health and social care from the patients or the clients. So for that, doctors, nurses, and even other social workers or the occupational therapists, we are having a separate guidelines. So those guidelines, we are telling it as a systematic guidelines. As it is a kind of systematic way we are gathering informations. So we are asking one set of questions, then we are going for the next set of questions. Likewise, we are asking from the patient. So why we are having all those sets of questions, then if we identified, if we get the answers from or for those each and every questions, then it will be easy for us to collect all the necessary information we need. So that's why we are having a set of guidelines. So most of you are not, I think most of you are not related to the health field, and sometimes you were not aware regarding these assessment process terms, but it's okay. I will explain each and everything in detail. In the future lessons, we are going to learn how, as a, in the health sector, what are the guidelines are available in order to get the assessment information, and what are the tools. Tools means some equipments or the techniques are available for each and every procedure. We can use those things to get the information. So for example, as I already told you, so getting the informations from the patients by asking the questions, it is a one kind of assessment tool. So we are allowing the patient to talk as much as possible. So we are encouraging them to talk. Once we encourage the patient to talk only, we can get the maximum information. So it is, so here we are using different communicative patterns or the techniques. So how we can communicate with the patient and what are the questions we can ask from the patients. So there are open-ended questions, close-ended, so open questions, closed questions. So there are different skills are available. So all these skills and techniques we are used in order to get or in order to gather the information in a health and social care setting. And the exploration part through which the professional gets an understanding about the client's problem, strength, inter and intrapersonal, as well as environmental factors that the client is living in. Yes, so another important one, why we need to gather the assessment means, so in the assessment, we are not only focusing on the patient physical condition. Physical condition means the physical disease of the patient, whether the patient is having disease or not. So we are not getting the information only for the physical, but through this assessment, we are checking how the patient psychological condition is, whether the patient is psychologically stable. So to check this, only we are allowing the patient to talk as much as possible. It is a way of asking the patient to express themselves, because sometimes some patient may be psychologically ill due to they are not having anyone to listen their sorrows or listen their feelings. So that's why we are asking the patient. So normally we can't tell that even sometimes some patients or some people, they are not talking well. They are less talkative or they are always living in a lone environment, lonely. So because those people are not taking or they are not like to live in those kind of environment, but sometimes they are not having any one person to listen their problems. So as a nursing officers, normally mostly nurses are the one who are doing these things. So because nurses are mostly spend their time with the patients, and another part is caregivers. So caregivers are one part coming under the nurses. So nurses, normally these caregivers are trained by the nurses most of the times. So caregivers also there are also a licensed healthcare professionals like doctors, nurses. Caregivers also one of the professionals, and in nowadays in the present world, the most prominence is giving to the caregivers because normally nurses also we are not having that much of time to deal with the patients. We are not also having not much time to talk with the patient. But if we talk about the caregivers, one caregiver is allocated for one person, one patient. So they needs to spend all the time with the patient. So in that time, sometimes the people, if the activities or the skills and the qualities of the caregiver is good, then patient also starts to express their sorrows and their feelings to the caregivers. So it is a kind of remedy for any kind of psychological problem. So if our brain and if our mind is well, then automatically our body is also going to be well. So that's why we need this kind of remedy. So we need to instruct the patient. So for this, assessment is important. Why? In the assessment, we are asking the patient to talk. And also with assessment, we can identify the socio-economical status of the patient. So we are having in the guidelines, we are having a separate parts. So there is one part we are as a socio-economical status. How the economically, whether the patient family is economically stable or not. How about their annual income or the monthly income? Whether it is adequate for their survival. Why? Because as I already told you, nowadays most of the hospitals are running out of medications, tablets. And even in the outer side, in the private sectors or in the normal, in the outer pharmacy also, we can't get so much of medications. They are also having very less amount of medication. And also the price of each, even one tablet is 1,500 rupees, one tablet. So if the patient is not economically stable, then we can't ask them to. So we need to check whether the patient can afford to buy those medication. So if the patient can't afford to buy a medication, then we can set up some welfare. So there are some welfare societies available in the in the community. So we can ask the patient to talk with them, and we can link them and to get some kind of help in order to for their healthy purpose like insurance, health insurance with us we can have. And the other one is environment. Environment also it is important. So what is the type of environment that each and every person living? Not only the food and not only the food is causing problem to us. Our surrounding also one of the causative factor for the emergence or the origin of any disease condition in our body. So for example, simple example is dengue. So why dengue occurs? Due to the mosquito bite. So if the surrounding environment is not clean, if we allow the barrels or the waters to staying in the rainwater to stay, and then it starts to we are promoting to breed the dengue mosquito, then we will have we ourselves or our family members or friends also starts to get the problem or the disease condition. So it is a simple example. So these environmental factors in the assessment we are checking. So if the person is coming and telling that, okay, I'm having the dengue fever, the patient is suspected with dengue fever, then we need to check not only the food pattern for the dengue fever, we need to check what is the environmental condition, whether he is having a good environmental condition and whether the uh, waste disposal is in a proper manner and whether the water supply is good water supply, how they are having, whether the environment is clean, whether they are maintaining in a proper manner, whether the ventilation are present, all those things we need to gather. Then only we can go because for the dengue, it is not caused by any food allergy or it is not doesn't caused by any food problem. So it is mainly caused by an organism like mosquito. So it is definitely occurs if we are not having a proper environment. So for that, we are having this assessment. Goal setting and interventions largely depend on what is being assessed or has been assessed. So yes, goal setting and interventions. Goal setting means planning. So if one patient admitted to the, for example, okay, one patient admitted to by complaining about dengue fever. So we diagnosed, okay, this patient is having dengue. Then we need to plan. So what we can do to alleviate that dengue fever for the patient. Excuse me. So that is we are telling it as, so goal setting means our goal is, so goal means our aim and objective. So if the patient is having dengue, so our goal is to to alleviate or to protect the patient from the dengue fever. So that is we are setting a goal. So once we identify our goal, we need to plan what are the things that we can do. So we can give more amount of fluids to the patient, and we can ask the patient to have a bed rest and take good foods, and we are going to check the patient blood count. So these things we can do in a hospital setup. So though, and if it is in for the family members, we can ask them to clean the environment, keep the environment very tight manner. So remove all the stained water and the empty buckets and the barrels. So those things we can educate to the family members apart from the hospital management. So those things are planning. Intervention means, so we planned and we are checking whether we can apply all the things to the patient. Sometimes when we provide adequate amount of fluid and if, with the bed rest, if the dengue is in a mild state, the first stage, so with this we can cure the patient. So we can resolve the dengue. So no need to do all the other things. So those are interventions. So what are the solutions that we can give or we can implement to the patient? So to identify the goals and to plan and to implement all the solutions, first we need to get the information regarding the problem. So if we gather the information and if we find out, okay, the environment is not good only, then we can instruct the family members to clean all those things. So we can able to plan in that manner. So if we are not having any information regarding the patient condition, then it will be difficult for us to plan and to set a goal to plan them and implement. So for the management, at foremost, we need to assess and we need to gather the information. It is another important one regarding the assessment. The accuracy of the assessment determines practicality and success of the goals. Yes. So how we can determine whether the assessment is accurate? So one, if the collected data are accurate only, our goals could be success and it should be practically applicable. And also it can bring a clear and positive changes on the relevant field. That means if the informations gathered are very accurate and evidence based only, we can set a proper goal and we can implement. So if we implement only, if the all the informations are correct, then we can plan our goal according to that particular problem. So if the planning is relevant to the particular problem only, it will resolve that particular issue. Then we can make the changes and our goal could be success. So for example, if those rashes could be occurs even if the patient has any allergic condition as well. So without having a proper information gathering, by only observing the red color spots, and if we think, okay, the patient is having some allergic reactions, or if the patient had some allergic reactions and if we miss diagnosed or misunderstood as it is a dengue fever, then the management could be differ. The management is not related to the allergic reaction. So if we are not providing a proper management, then the patient starts to become more and more severe, even if we are providing. So though in that manner, so the materials are wasting, and there could be a material wastage, resource wastage, time wastage, and even there are no good care services. So that's why, so with the assessment accuracy could be determined how the goals become success. If the goals become success, then okay, the information gathered are very, very accurate. And if they changes, so changes means it not be a negative changes, they are positive changes. Positive changes means if the disease condition improved, that means if the disease condition resolved step by step, okay, then the collected informations are accurate. So this is regarding the assessment. Just simple introduction regarding assessment. Are you all clear up to now, or do you need any clarification more? Because sometimes some people are may not aware about these terms or the activities that I told you. So don't worry about this. We will learn in detail and I will teach you in detail. But as an overview, you need to know, you need to have some kind of idea what is this assessment, especially that we are following in the health and social work. So if you tell that you are clear only, I can move to the next slide. Or I can explain again also.
I am clear, Miss. What about others?
Others?
Okay, Miss, you can carry on.
Okay, thank you. So these are some of the definitions related to the assessment, because there are each and every scientist and the researchers, they have developed each and every definitions according to the idea they are having. So assessment means you can use, if somebody asks a definition for the assessment, you can use any one of the assessment. Okay, so the major content or the basic concept of all these definitions are same, but according to the each and every researchers and the scientists' opinions, they added some words and they removed some things. So those could be some kind of differences. But the basic thing is assessment means a systematic way of gathering the information from a person or any other group. So that is the simple thing. So here the Hepworth and Larson in 1986, they proposed one definition as a process. So process, it is common. So it is a process. It is not just a one-time activity process. So it is a process of gathering, analyzing, and synthesizing. Synthesizing means generating. They are forming. So they are gathering, they are gathering something, and with the gathering they are analyzing whether which is good or bad, or whether it is true or false. And with that analyzing, they are formulating or they are generating their own new ideas. Okay. Essential data into a formulation that encompasses the following vital dimensions. So according to them, they are telling that they are gathering the data, they are analyzing the data, and they are synthesizing some essential activities which could be used in order to which could be used for the treatment purpose or for the any management. So in their assessment, so they are telling that for the formulation of these the data or any other things, they are containing these vital components. So first one is the nature of clients or patients' problems, including special attention to developmental needs and stress associated with life transitions that require major adaptations. Yes, first one is, so they are telling one of the first information that they need to gather is what is the problem of the client. Yes, so with the assessment, we are gathering what the patient problem is. So this problem not only including the simple physical problems, it is also including whether there are any special attention like developmental disorders. Developmental disorders mean psychological problems or some small babies, they are not developed the brain well, or they are not having all the organs are not developed properly. So all those things we are telling as a developmental problems. And stress, depressions. So the associated with the transition that require major adaptations. Life transition means, so think about the cancer people. So cancer people, they know, okay, they are having very short a period of time. They are going to end their life soon. So, or the totally their life is going to be changed when compared to the previous manner. So think, so now I am happy, I am doing my job in a normal position. So I am having my own stuffs and I am having my own wish, desires. I'm going to my job and coming and spending time with my friends. So I am having some kind of balanced and a happy life. But suddenly, if I am diagnosed or if I heard that I'm diagnosed with a cancer, then all the things are going to be changed because I will think more and more. So how can I go to job? Because normally the cancer people, you all know, they start to have some kind of hair fall. So they become bald eventually with the treatment. It is not due to cancer. With the treatment for the cancer, they start to lose their hair and become bald. So those things I am going to think that because how I am going to survive. So what is my survival period? So because the pain that is caused by this cancer is very, very severe. So those things I am going, so I am become depressed and stressed with that information. So those uh, stress and depression going to change my normal balanced life into some stressful situation. So with the assessment process only, we can gather information how the patient was earlier and how now how the patient is feeling and how they are adapting to those kind of changes. So those problems we can identify. So problem means not only the physical disease condition. Coping capacities of client and significant others. Coping means normally we are referring to how a person facing their disease condition, how they are challenging to overcome their problems. That is, we are telling it as a coping. So like under the coping, how they are perceiving, how they are viewing their disease condition. What are the activities they are taking in order to overcome the stressful incidents? Those are coping. So for the assessment, we can identify how the patient is having, what is the state of patient's coping. So whether the patient is okay, what that means, whether the patient is very sensitive or whether the patient is having very confident to fight against their disease condition, whether they can able to tolerate all the pain and all the investigations that is going to do. So that is the capacity we need to. So with the assessment, we can identify by the words of the patient, by the feelings they are expressed, we can identify how their capacity. And in addition to the patient's coping capacity, we can talk with the family members. It is also must because normally you already know that we are having a person-centered care, a collaborative care. So mostly it's okay to involve the patients, family members, spouse, good relatives, friends into the treatment option as well. So in that manner, we need to identify how the coping capacity of the family members, because the patient, if normally if the patient is having any disease, also if we admitted to the hospital, we need some kind of assistance. We expect some kind of assistance from the third person. The third person means family members or the friends. Although we are having a minor disease condition, we think okay that we can't do anything alone. So in that situation, if the surrounded people of that particular patient is very supportive, and if they are very confident, and if they are very tolerable persons only, they can provide their care and support to the patient to some extent. If they are very weak and sensitive and they can't accept all the conditions of the patients and crying and doing all the messy things, then the patient also starts to feel down. So in that manner, we need to talk with the family members in order to identify the coping capacities. Relevant systems involved in client's problem and the nature of reciprocal transaction between clients and these systems. So here system means the body system. So what are the systems involved in the patient problem? Whether the cardiac system or whether the patient related to any respiratory problem, lungs. So what are the system and the transaction, reciprocal transaction means opposite. So normally normally lungs means lungs, it is used for respiration. Heart means it is pumping the blood to all over the body. But if any problems occurs in the heart, then the heart won't pump the blood to the body. If the heart is not functioning, then the patient, that's we are calling okay heart attack, and the patient become dead. So that is called reciprocal. Reciprocal opposite to the normal function. So those things we need to identify whether all the patient's systems are working in a normal, proper manner. Resources that are available or are need to remedy or improve problems. So, okay, so availability of resources. So whether the resources are available or not. Client's motivation to work on their problems. Yes, another client's motivations. How the client, whether the client is motivating themselves to face their problems or face their diseases very challengeably, whether they are good enough to fight, whether they are now in a good state to fight against their disease condition. So this is one kind of definition which was proposed by Hepworth and Larson. So they are telling that assessment means, so when we are gathering the information, they should needs to focus on these 5 major criteria. This is one. Then second one, it was proposed by Barker in 2003. He also is telling here process. It is also process of determining. So he is telling this process which helps to identify the nature of the problem, the cause of the problem, the progression means, so the improvement. So the problem, how it was before and now how the problem, whether it is become worsening or whether it is improving in a good manner or bad manner, and prognosis. Prognosis, it is a medical terminology. The normal term is prediction. So how we can predict? Predict means sometimes with the health assessment, when we are with the assessment, we can predict that, okay, so when we compare to the patients earlier, now the patient is having the symptoms are reduced. Okay, so we can assume that within 2 to 3 days, we can discharge the patient. So we are having some prediction. That is prognosis. Prognosis of a disease means we are predicting something, whether the disease could be completely resolved or not. That is prognosis. So we can determine or we can identify all the problems, all these criteria of a problem, and the personalities and situations involved there. And also we can identify how the patient personality is and what are the situations that are causing for the occurrence of this problem. The social work functions of acquiring an understanding of a problem, what causes it and what can be changed to minimize or resolve it. So in addition to the physical things, the social activities also, that means the environmental activities also we can get in order to understand how the problem is caused and what are the changes that could be occurs to minimize or resolve the problem. So this is stated by the Barker. Then Crispin and his colleagues in 2003 again, they are proposed that it involves collecting and analyzing information about the people with the goal of understanding their situation and determining the recommendation for any further professional intervention. So he also simply stating that it is involving information collection and analyzing, which could be helps for the professionals, healthcare professionals, in order to identify further interventions and also with the by having an idea regarding the situations of the patient. And in 2012, Cowshed and Ohm, they also stated that it is an ongoing process. Yes. So it is not a one-time process. It is ongoing process, which is participatory seeks to understand the service receiver and his or her situation and sets a basis for planning how changes could be improved and can be achieved. So all these definitions are stating mainly it is a kind of process of gathering the information for the management, or not only for the on-time management, but for the future management purpose as well. So you can use any one of the definitions if you asked to define the term assessment. Okay, so when we are talking about the assessment, that means when we are going to gather information from the patient, we should monitor some kind of factors. Factors means the things which could be affect or which could cause impact in a particular object. So these factors should be addressed when we are talking about the assessment. So in other words, when you are gathering the information, you could give prominence to these things when you are gathering the information. So first one is client's primary problem or concern. What is the major problem of the patient? And if there is any current or if there is any pending legal instructions, must the client and social worker, it should be considered. Okay, so whether there is any legal problems are available. Potentially serious health or safety concerns must require the social workers and clients' attention. So whether there is any potentially serious health or the safety concern should be required or not. And what are the specificity? So not all the problems are having same thing. So each and everyone having any one or two specific conditions. So what is the specificity of a particular patient's problem? And how the patient perceive, how they think or how they view their problem, whether they are viewing in a bad manner or whether they are okay, whether they are accepting or whether they become anger. So how they are perceiving their problem. And what are the problem systems involved when we are talking about the, when we are collecting the assessment. And what are the causes or the reasons for the patient's problem. And where, so which is the starting point this problematic behavior occurs. So which is the starting point and when it occurs and what is the duration, how long. So for example, diabetes means, so from which part it occurs. So where it occurs means, so due to which condition it occurs, whether the patient eaten lot or when it occurs. So the duration, that means 10 years before or 5 years before or the recent times, so those things. And then what is the current need of the patient is having problem, and also to resolve that problem, what the patient needs currently, what he's expecting for a healthcare professional or what he is expecting for his survival rate. And also history. Okay, so the history, whether the patient has had this problem earlier. So earlier means how many times it occurs and what are the resolutions they have made for the particular problem. So those history. And the frequency, yes, how many times it occurs, and the intensity, how the magnitude of the problem. And in previous times, if the problem occurs, how the patient handle those problems, or now also how the patients attempt to handle. So whether they are very tolerable enough to handle those problems, or whether they become sensitive and they become depressed or likewise. And what are the skills and abilities used by the patient to face those problems. And also, in addition to the internal factors, what are the external factors or the resources that are used by the patient in order to combat, means in order to fight against the problems. And the patients itself, what are the resources they are having, what are the skills, and what are the strengths and capabilities they are having in order to resolve the problems. And also, what are the recommended course of action you can provide as a professionals for the resolving of the problematic behavior. So when you are asking, or when you are assessing a patient, you can just go through, or you can develop these things as a question in your mind, whether you have collected. Because if you focus on this, then majority of the informations could be gained from the patient. So in addition to the each and every guidelines, so you one time you just think about yourselves, where you can ask from yourself whether these questions have been answered by the patient or not. So these are the factors you should be focused mainly when talking about the assessment. Are you clear up to now? Or do you need to clarify more?
Notes.
Okay. Then we'll move to the next part. So far we have studied regarding the assessment and the factors. Then when we talk about the assessment, so what are the critical role? Because it is not the simple information gathering activity. So it is some kind of systematic way. It includes most the sequential steps within it. So in that manner, how this assessment having, so what is the critical role of the assessment? So normally it is not the simple process. So in other words, we are telling assessment is a critical process, especially in the social practice. For the nature of the goals and the selection of relevant interventions are largely based upon the assessment. So due to these interventions and the goals are based upon the assessment or the informations that we are gathering only, we are telling that this assessment is having a very, very critical role in a social practice. The following factors should be stated why the assessment is critical in health and social work. So why? First one, it helps to enhance the quality of information gathering, and also it helps to make the assessment more professional and technical, and understand the determinants of eligibility of the professional as well as the client, and it provides access to the solutions and the most suitable services, and also it offers support at the time that is often stressful. So due to these factors only, or due to these properties only, we are telling that assessment is a kind of critical process which we are used in a health and social care practice. Okay, so there are lot of principles are available when we are talking about the assessment. So here I have put some of the principles when we are talking the assessment, especially in the health and social care setup. So first one is, as we already know, that it is not a single event, because it is a process. So it is continuing as a cycle. And also, and it should be an open process. So they are open process means you should have and problem. So we can the page would be asked, we can the broad informations with the accurate one. And it must be promote valid intervention. So the interventions that we are providing should be very, very validated one. So if the informations are accurate only, the interventions or the solutions that we are formulating could be valid. Should always employ multiple measures of performance. Yes. So with the assessment, we can identify multiple measures for each and every activity. We can gather multiple choices. Then we can identify and understand. So we can identify as well as we can understand the needs of the patient, and we can work with systems and ecology. So we are not going to work with the people only. We are going to work with the environment as well, because the ecology means the systems, the environment that are surrounding us. And also it could be helps to build the strengths on a patient, and it should be a person-centered or the patient-centered care activity, and it is taking an interprofessional approach. So these are some of the principles that the assessment should be followed when it practiced in the health and social care setups. These are also some of the basic principles of the assessment, like reliability, validity, authenticity, objectivity, practicality, interpretability, and washback effect. So these are the terms that we have studied these in a detail. So these are some of the basic principles of assessment. So we can use in health and social care sector as well as in other workplaces these principles. But these are some of the basic principle of assessment. But depending on the workplace, the principles for the assessment could be different. So there could be some differences as well. Now we'll see what are the qualities of a good assessment. So if we are telling that, okay, this assessment is a good assessment, then with what qualities you can tell this assessment is a good assessment or the bad assessment. Mainly, there are 5 major qualities. So valid or validity, fairness, transparent, reliable, and feasible. So valid means, so what are the measures you need to measure at the appropriate level in the appropriate time. So validity means, so when the informations are gathered, so those information should be valid. So whether you are gathering the appropriate information, so those informations are relevant to the current problem of the patient, and whether the questions that you are asking are relevant to get the information about the current needs of the patient. So those things we are telling is a validity. Fair or the fairness means, so the activities, the questions that you are asking from the patient should be non-discriminatory. If you are asking, so you need to be focused on the patient's problem only. So you can't think that, okay, this patient is a male patient or this is a female patient, so we can't ask these questions. As I am a female nursing officer, I can't ask those questions to the male patient. So no, not like that. So you need to ask because you are going to, because you are the professionals. They are the care receivers. So your job and your duty is to provide care and support to them. So if you think those those age and gender, and if you are going to neglect, then it could be going to affect the patient care and the patient survival rate, because sometimes the neglected parts are most important for the management purpose. So the assessment, it should be fair. There could not be any discriminatory activities. Transparent means the informations that you are gathered for analyzing and for the documentation purpose, it should be very, very clear and accurate. So there could be no any suspicious thing, or you can't hide any things. So transparent means you need to get all the informations which should be very, very clear. Reliability means another part, the informations gathered should be accurate and it can be repeatable. That means repeatable means, so if the informations are very accurate, then we can use in a future any management purpose as well. And it should be consistent. It should be firm. So there could be no any changes if they are, and it should be an evidence based. So those reliability define those things. And feasible means whether it is practicable. So whether the assessment gathered informations are according or practicable in terms of time, whether the resources are available. That means in the resources mean assessment tools, whether the assessment tools are available, and how about the patient number. So those things we are telling as a feasible. Feasible means a easiness for whether the information gathering could be easy for. As a healthcare professional, you also feel easiness to gather more information. So these are some of the qualities we are telling that if assessment of one healthcare professional contains all these qualities, then we are telling it as a good assessment. So if it is a good assessment means it contains all the important and much informations regarding the patients. Then we can develop our goals and interventions for the particular problem to the patients. So when you are formulating assessment, these criteria also should be considered. So are you all clear up to now? Or do we need any clarification?
No, miss, it's clear.
Okay, thank you. Now we see the assessment skill. So as a healthcare professional or as a professional, if you're going to make any assessment from an individual, so you need to have at least some of the skills. It's good to have all the skills, but you need to have at least some of the skills in order, then only you can have a good assessment. So because assessment is not a simply gathering information. So you should have some kind of skills in order to gather the informations that you are expecting from a patient. So first, application of knowledge and skills in practice. So you need to be applied. That means as a healthcare professionals, so you need to apply. When you are asking the information, so you need to apply the knowledge and the skills that you have practiced. Both the theoretical knowledge and the practical knowledge and the skills you need to apply. And knowledge and understanding of the complex any other calculatory. If it is related to the financial, if it is a resource management, you need to have some kind of calculatory, complex calculatory understanding and the knowledge. The third one is effective communication. Yes, it is also very, very important one. Once your communication is very, very effective only, you will gain the more information. The way that you are talking, the way you are conveying the message to the patient. So the way you are asking the questions, the words, the phrases that you are using will not hurt the patient psychologically. Okay. So normally we are having psychologically assessment tools as well. So there are different tool. One tool is like that. So in that tool, we are not having the questions that we are thinking. So when we are going to assess any patient in a psychological patient, if we are going to talk with them, we are formulating a separate guidelines and we are checking with the people who are expert in that field more and more time, because if it is psychological manner, you can't ask any questions as your own, but whatever you think. Okay, so because it will hurt the patient mind. So it can cause, see, it can worsen the patient condition as well. So in that manner, we are having the words and the phrases, the questions that we are asking, having some kind of hidden, indirect manner. Normally for the patients, we can ask indirectly in case of if we think that it's going to hurt the patient. So effective communication is one of the most important skills that any one of the professionals should develop in order to have a good assessment. Then critical evaluation and the critical analysis. So once you gather the informations, you can analyze and you can come into the conclusion as a normal other evaluatory process. You need to think critically. You need to check each and every information. And you need to identify the inner depth of that. So that is, we are telling it as a critical analysis. And once you are formulating the solutions, it should be very, very critical. So you can't just, if it is a fever means giving Panadol, the patient no need to come to the hospitals. We can buy the Panadol from the outdoors and we can take. But the thing is, not all the fever could be settled with the Panadol. There are some situations where for the any other disease condition, we have developed fever. So the Panadol can't resolve that fever. So we need, so that manner you need to think critically. So why this patient develop fever, whether it is a normal fever or sometimes patient may tell that I took Panadol for 3 or 2 days, but the fever doesn't resolve. Then what is the cause? So that is, we are telling it as a critical analysis on the critical evaluation. Listening skill, yes. So when you are having a assessment, gathering information, you need to listen carefully. We are telling it as an attentive listener. So a professional should be an attentive listener, means you need to be listen each and every words tell by the patient very, very carefully. So if you are not listening properly, then you can't get. Sometimes the patient may tell some things indirectly with some hints, clues. So if you listen carefully only, you can identify that. Observation skill, skills, yes. You need to observe the patient. So how they are expressing. So sometimes sometimes the patient may talks normally, but if they talk about their family members like their daughter or son or husband or wife, they may show some kind of facial expression. So the normal facial expression could be changed. Sometimes they become happy or they become sorrow, and how their body language become. So once you observe the patient completely only, you can have. So with the eye contact. So normally if the patient is telling truth, they will see your eyes. But if the patient is not telling the truth, no, it is common. We are not maintaining a proper eye contact. So you need to check whether the patient is maintaining a proper eye contact or not. So that is observation skill. Peer assessment. Peer assessment means normally each and every healthcare professionals, they can assess their qualities and abilities with their colleagues. So I can have some guidelines and I can ask my colleagues, my co-worker to assess my abilities and capabilities. Am I professionally fit? Am I doing my job professionally? It is one kind of peer assessment. Planning and time management. Yes. So you need to plan, because normally you can't go to the patient side and talk with the patient for 2 or 3 hours, because sometimes patients are not willing to tell. Patient may have so many problems. They may have fever, severe pain, or they may need to sleep. So for that, so if the patient is go ask, or if the patient tells I'm going to sleep, okay, then you can allow the patient to sleep. Then you can have, you can set up a time period, but you need to have, okay, you need to inform to the patient that I need to have some information about you. So I will come within 30 minutes. So please stay up, don't fall asleep. Okay. So I will take only 30 minutes for the history collection. So for gathering the information. So if it's so, so because you already informed to the patient, so you need to come on time and you need to gather in that time. You can't extend, because if you have a good guideline, then it will be gathered much information with a shorter period of time. But if you are not following in a principle, if you are not following in a systematic way, then you need more and more unnecessary time period. And presentation skills. Presentation skills means how you are presenting. Normally, after gathering the information, the officer or the consultant. So the way that how you are presenting to them. So when we are presenting, we need to tell the important points of the patient. No need to tell all the unnecessary information. So how you are presenting. Then how you are summarizing, because you gathered all the informations, but you need to summarize in order to identify the patient's condition at one glance. For that easiness, how you are going to summarize. Then self-evaluations. You can evaluate yourself. You can ask some questions, whether I am working in a good manner, whether I am a time manageable person. Likewise, you can evaluate yourself, how you are a professional in your profession. And then subject or the field specific knowledge. And you should have a specific. So once you are a nursing officer, you should very thorough about all the disease condition. At least you need to know why this disease condition is causing, what we can do. So what are the likewise, you need to be specific in related to all the field. So these are some of, so not only these, there are plenty of assessment skills are there. But these are some of the major or the important assessment skills that you need to follow when you are gathering the informations. And it is good, but not all the people can follow all the things. But the important things are you need to apply and you need to have a knowledge and skills in a specific field. And you need to have a very good communication skill, listening observation skill, and summarizing skill, analysis and evaluation should be critical. So these are some of the most important ones you need to be follow when you are gathering the information. Other than this, if we follow other things also, it's good. This is regarding the skills in the assessment. Now we'll see strength in the assessment. What are the strength of this assessment? So when we are having this assessment, why we are focusing or we are giving this much of importance to this assessment? Facing problems and seeking help rather than denying or otherwise avoiding confronting them. Yes. So with the assessment, we can face any problem. So once we identify the disease, the particular informations, then we can face the problem, because with the information, we can, however, we can identify the solution. So we can face the problems. And it is, yes, it is important. So rather than avoiding the problem, that means or blaming others or blaming the God to get this disease, if we are very confident enough to face the problem, then it is better. We can improve our survival rate also. Take some kind of solutions or the resolutions during the difficult instances. And this we can express the caring feelings not only to the patient, to the family members and their friends as well. with the assessment, we can maintain one's right to justice. So with the assessment also helps to consider work or a financial activities. And also we can understand what are the needs and what are the feelings of the other people. And this assessment also will help to demonstrate the self-control, because as a healthcare professionals, you should be empathetic but not sympathy. So it is common. So if a person is telling that their family situation, it is common to become emotional. But as a healthcare professionals, if you are become emotional, then you can't help for the patient to cope. So as a nursing officers, when we are entering into the nursing profession at the very beginning, so at the oath, when we are taking our oath to at the very beginning, we are telling that we should be served with empathy, but not the sympathy. And it is common when you see in the public hospital, sometimes the nursing officers, they are, when you are telling anything, they are just in a stiff manner. They are not, they are behaving, they are not considering those problems. They are asking your feelings, but they are not providing any sympathy, but they are having some kind of empathy. The thing is, so yes, it is. So all the nursing, even the doctor or the nurses, we are working in an empathetic manner. We are removing our we are emotionally stable. So we are not become sensitive. If we become sensitive, then we can't help for the needy people. So that's why we are very, very emotionally stable. And so that emotional stable, it means we are controlling ourselves, especially emotionally. Being able to function effectively in a stressful situation. Yes. So it normally it is a very, very, all the jobs are stressful, but think about when we are talking about the health work, social workers, it is very, very stressful, but this assessment will be very, very helpful in order to function effectively, in order to overcome the stressful situation. So these are the strengths when we are talking about the assessment. So once we have the assessment is having these strengths. That's why we are giving that much of important for the assessment in the social and healthcare sector. Then we'll compare the assessment and evaluation. Okay, you already know regarding the evaluation because you have already studied the policy evaluation, procedure evaluation. So you have an idea. So now we'll see what are the differences between this assessment and the evaluation. Here, these are some of the characteristic features or the criteria which we can compare the assessment and the evaluation. So meaning, when we see the definition, it is a process of collecting, reviewing, and using the data for the purpose of improvement in the current performance. But the evaluation it is as an act of passing judgment on the basis of set of standards. Yes. So evaluation means assessment. We are identifying, or we are gathering, we are analyzing and reviewing all the data that we are gathered in order to improve the current evaluation. Means already we have implemented something, so we are just checking, we are judging going according to the principles, according to the standard. Nature is with the informations only we are shared. It is diagnostic. But evaluation, it is a judgmental. We are judging whether you are or not. So what this assessment does, it is providing feedback for the improvement. And evaluation, it is identifying whether the goals that we have planned are achieved or not. So for the evaluation, the assessment is important. So when you any activity, assessment is the beginning part and the evaluation is the end part. So first you gathered and you are setting a goal and you are implementing, then you are evaluating whether your goals are achieved or not. So this is a process. purpose orientation, so it is a formative, that is, it is a process oriented, and evaluation is a summative, it is a product oriented. So assessment, it is mainly focusing on the process. Evaluation, it is checking the product, how the product, it is telling how the products feedback based on observations and the, so normally it is based on the positive and the negative points and observation, and it is based on the level of standard. So how they in a standard level or not. So it's one kind of a comparison. Here another one. So the normally assessment and evaluation. Assessment is an ongoing process, and it is positive and it is individualized, providing feedback. Evaluation, it is not the ongoing process. There could be some kind of closure. That means should be some end in some point for the evaluation, and it is judgmental. It applied against the standards, and it shows the shortfalls. That means whether there are any whether the goals are achieved or not, or whether we need to change the goal settings whether we need to do any changes in order to achieve the goals. So these two are the differences, but these assessment and evaluation have one common thing, which is both should request criteria use measures are evidence driving. Yes, the thing is the criteria or the informations that we are gathering should or must have an evidence. So all the informations, all the criteria that are gathered is based on the evidence. That is the common thing between the assessment and the evaluation. Other than this, these are the comparison. So are you all clear up to now? Or do we have any doubts? Are you all clear?
Yes, ma'am.
Sorry? Okay. Then we'll move on to the types. So no need to much worry about the types of the assessment, because these types also could be differ. So when we talk about the educational assessment, there are different types of assessment types are there. And in the health and social care, another different types are there. So no need to be worry or no need to be concerned more about the types of the assessment, but I put all these differences and pictures because you just need to know. So what are the types are available? So, but no need to go in deep regarding the assessment. Okay. So here you can identify three assessments. So these three are the basic assessment types. You can see any, you can apply to any kind of workplace. It could be educational assessment or the healthcare or the social care or any other workplace assessment. You can apply this. So these are the basic three: diagnostic, formative, and summative assessment. Diagnostic assessment means it is used to identify the current problem or the current practice or the knowledge about a particular problem. So what are the knowledge or what are the idea that an individual is having regarding a current problem? Examples are like observations, interviews. So in the interviews, we are identifying the person's current interview, also kind of assessment. And self-assessment, assessing self-evaluations and observations. Observations are also a diagnostic assessment. We are observing and gathering the informations at the current time. It is a diagnostic type. Formative type, it is providing a feedback. So as we already said that normally in the health and social care, the assessment is basically or the generally is a formative one. So it is helps to providing the feedback regarding the particular action, like homeworks. When we talk about the educational purpose, homework is kind of feedback related to a particular learning subject. So the teacher, they are teaching and they are giving the homework. So with the homework activity, we can identify, we can assess how whether the child or the student understand or not. Then peer reviews. Peer reviews means the peer evaluation. That means I am asking from my coworker to assess me. So he is going to provide feedback on myself. So how I am working, whether I am professionally fit or not. So it is one example for the formative uh, assessment. And then summative assessment means it is used to sum up learning at the end of the instructional purpose. So formative and summative, formative, it is providing feedback during when the process is going, it is providing the feedback, but summative, it is providing all the informations or all the good and bad outcomes once the process finished at the end of the process. So when for example, when we are going to provide the treatment for a patient, so the formative in between the process or the management, we are assessing the patient condition, whether it improved within 2 weeks or 3 weeks. It is formative, but summative, we are administering all the, for example, antibiotic medication means if it is for 14 days, we are not having any assessment in between that. At the end of the 14 days, we are getting the sample from the patient. We are checking whether the microorganisms died or not. So whether the patient resolved or not. It is summative at the end of the process. Example, checklist that we are using for our exam, final exam purpose we are having, and then multiple choices questions. So those, the final end exam, when we are talking about the educational purpose, the final exams are summative. At the end, we are checking how the student studied so far. So these are the three basic assessment types that it could be applicable in any sector. Other than that, you are having other types as well. Here, confirmative assessment. So confirmative assessment means it is confirming how the effectiveness of the assessment are, how the informations collected are effective or not. Non-referenced assessment means it compares the student's performance against fixed average. So when we talk about the students' educational purpose, this non-reference assessment, normally we will have some average marks and we are comparing how the student's marks is. So normally in the school setups, we are issuing report cards. So in the report cards, we are indicating the highest marks and the student marks. So we are comparing how it is. It is non-referenced assessment. Criterion reference assessment means it is going to evaluate, or we are going to evaluating a specific skill or the specific knowledge of a particular person. And ipsative assessment, it tracks the learner's progress against their previous. So it is evaluating the learners, or if we are talking about the professionals, so it is going to evaluate the professionals' activities, how they were before and how they are now. So their performance, we are comparing the performance in the previous performance with the now performance, the current performance. So these are another 4 kinds of assessment types that you can see in different sectors. So no need to go in deep and analyze this. So you need to know just what are the types available and what are the purpose. So why we are using this assessment with simple examples. Okay, then we'll move to the assessment process. So this is an assessment process that we are using in a health and social care. So here we study regarding the care planning. It is also one of the structural way of writing. There could be a structural way of writing care planning as well. So when we talk about assessment process, so these are the sequential steps. First, you need to gather the information. So because gathering, you can gather all the information collectively. Then you need to separate it and you need to order which one should be first and which one should be second. And with the ordered data, you need to analyze. With the critical analysis, you need to analyze this. And with the analyze, you can develop the options. What are the available options are available? So you need to identify what are the options are available, all the options. And among that options, then you are going to think critically. And you need to, again, you are going to analyze critically and you need to identify or select the appropriate option for the particular problem. And once you identify the option, then you can develop a care plan. So this is, we are telling it as an assessment process. So care planning, so identifying the, so assessment including data gathering, ordering data and data analyzing. But after analyzing, identifying the option, select a suitable option and implementing the option comes under the care plan. So as a nursing officers, we are writing a nurse's care plan. It is contains some sets of elements in it. So we will learn all these things in detail. So this is the simple assessment process that we are commonly using in a health and social care setting. Then this is a structure of assessment in a social work. So these are some of the components that we can include when we are talking about the assessment in the social work. So it should be dynamic and responsive. Dynamic means it should be changed, not in a one part. So assessment means the informations could be changed or you can use different tools. So dynamic and responsive based on engagement and inclusion, ethical skill, and it should be based in legal policy and context. Yes, it should follow or adhere to the policies and legal activities, and it should empower and outcome focused, and it is highlights the protection and safeguarding, holistic and comprehensive, involves judgment to support decision making, leads planning and future action. So these are the structures of the assessment. So normally in the social work, we can include these things when we are developing a assessment. Okay. So these regarding the assessment. Are you all clear up to now or do you have any questions? Do you have any doubts? So do we need any clarification?
Miss, it's clear.
Okay. Then we'll see the assessor. So assessor means an individual or organization responsible for the assessment. Yes, so assessor means a person who is going to take the assessment or who is doing the assessment. We are telling it as an assessor. So it could be an individual or it could be any organization who is going to assess the quality or who is going to evaluate a person or anything. That is, we are calling it as an assessor. So a person who is knowledgeable in a particular field and is called upon for advice, typically by a judge or committee of inquiry. And not all the people could be assessor as well. If you are going to be an assessor, you should be very thorough about the particular field you are going to make an assessment. And you need to have a thorough knowledge about to make a critical thinking and a critical judgment as well. Then only you could be called as an assessor. So there could be some abilities and skills an assessor should develop or possess when we are telling they are an efficient assessor. So here, these are the 10, not only these 10, there are so much, but these are major skills and abilities you need to be have or possess as an efficient assessor. So openness, so you should be an open-minded person. So you can't become very sensitive or you can't become very stick to cultural and other things. So you should be a broad and open-minded person. Then only you can get more information. Your assessment should be very, very accurate. Collegiality means you should be very companion with them. So you should be very friendly with the person. Agreeableness, so whatever the patient is telling, if you think it is it could be an acceptable one, and if it is the informations are accurate, then you should agree. You can't fight or you can't argue with the patient. And you should be calm, compassion or empathy. So here you can see it's not a sympathy, it should be an empathy one. And consciousness, so consciousness means you need to be very, very, that means a time management. You have a well planned and a time management ability. Then analytical skills, yes. You have a critical analytical skills, and objectivity means, so you should be work according to the goal, a aim. So you need to have aim. Curiosity, yes, curiosity is another important one. So once you curious about the patient only, you will have more interest. So curiosity means eager to ask anything or eager to work. So like, then critical thinking and flexibility. So you should be some kind of flexible. If your activities and if your questions are flexible only, you can develop a good relationship with the people you are assessing, and then only your assessment become more and more effectiveness. So these are the most common skills and abilities that an assessor should possess once he or she is becoming an efficient one. That's all about today's session regarding the assessment. So do you have any doubts so far? If you have any doubts, you can ask and clarify, because as it is the starting part, you need to be because most of you are not aware regarding the assessment that we are having in a health and social care settings. It could be some kind of different. So as a an idea, you for that only I have prepared this one. So you need to know what is this assessment and what are the components. So if I can now, or otherwise we can end up our session.
Yes, Miss, good.
Okay. I have already uploaded to the class notebook regarding today's lecture, so you can find out there as well. And I think some of them are requested regarding the extension of the time period for your first submission of the assignment, first task. But as far we discussed and we concluded that we can't provide the extension unless the reasons are valid. If we think that the reasons are valid reason only, we can provide your extension. Like if you have any medical certificates, if you admitted to a hospital, and if you find out any difficulties, then with the proper medical certificates and proper evidence only we can extend. Otherwise, others, you all need to submit your first assignment of my module on 7th of September. Second one is 28th of September. I hope you all are you are working on your assignments. So because some of them asked me, that's why we discussed and I told you.
Miss, you are going to send the email address to us?
No. We are planning to upload it to the MS team. So before that, we are planning to have some trial session. So they have already done to other batch, but for you, we are going to have some trial session. If you find out any difficulties for uploading those things in MS Teams, then we can provide the mail ID. So far, don't worry about that. So we'll have the trial session soon, and then we will provide if there is any issues regarding the MS.
Before 7, they are providing that thing?
Yeah. Before 7th, we will provide. Today or tomorrow, we'll see. I hope we will have the trial session today or tomorrow.
Okay, Miss.
Excuse me, miss.
Yes.
I am joining this course lately. I couldn't join this course at the start.
Okay.
So that's why we asked a grace period for the submission of assignment because didn't have enough time to complete. So if you can, please think about that.
Okay. So how many of you joined lately? Only you.
Actually, I don't know.
Okay. So those who joined lately, I convey the message to the management, and because I'm also not know who are the people joined lately. So if they provided any extensions regarding that, then I hope that you need to send a mail to the academic coordinator. I hope. So if possible, you can send an mail to the academic coordinator by mentioning your problem that you have joined lately. And I also convey this message today itself to the management. And let's see what they are telling.
Yeah, thank you.
Okay. So any other questions you're having?
No, Miss.
Okay. Thank you all for joining. Until I'll meet you in next class. Bye. Have a good day.
Okay, Miss. Thank you.
Thank you very much. Bye.
Bye.